Hi, I'm Dr. Bergeron with Houston Lipo Center. Today I want to talk briefly about chin liposuction. So first off, the technique I use. The same as all liposuction done here at Houston Lipo Center. I do tumescent liposuction using only local anesthetic and also use a laser for skin tightening. This is a 16 gauge cannula, and this is a suction cannula. It has small little holes that the fat suctioned into. I'll even put a quarter up there. You can zoom in and see how small this is. But these small cannulas are awesome for, very small areas like suctioning the submental area and the jawline. When a patient comes in for chin liposuction, two main things I'm looking at. What's the thickness of the fat layer and what's the condition of the skin, like how lax is the skin or how much skin laxity is there. And before I go to the photos, I do want to mention, where the incisions are for liposuction. So I do one incision, submental incision, just right here, and through that incision I can suction the entire submental area. But to get the jawline good, I'll do another incision just below the earlobe. I use a 1 millimeter biopsy punch to make these incisions. They heal very fast on the face. Generally within 2 weeks, are hard to even find. But so 3 little incisions that I do all the work through. So first photo, this is a woman in her early 50s. On physical exam, had some skin laxity. I found it was normal for age and nothing that I was concerned about. And fat layer, probably had a 1/2 inch pinch when I pinched under her submental area. You can see in the after photo, more definition of the jawline. You can see a more lean appearance in the submental area and more of an angle in the submental area. There's still a little bit of skin laxity, but let me show you the side view, the front view. And you can see from the front view, this was a rather dramatic result. You can also notice I do mark the jowls, and this is where from the incision that's under the earlobe, I suction down the jawline and get any fat that I find here. And you can see in the after photo that that bulge is gone, has more of a straight line down her jawline now. The total amount of fat removed under this patient, probably about 75 cc's, which is only about 5 tablespoons. This is a woman early 30s, good skin, moderate fat accumulation in the submental area. This was a little higher volume compared to the first case. You can see now more lean appearance under the jaw, better definition of the jawline. This was about a 1/2 cup of fat that was removed in the area. Gentleman in his 40s, again, good skin, just moderate fat accumulation in the area. You can see the after photo, pretty dramatic reduction. This was a higher volume case. This was probably almost a cup of fat that was removed from the area. Next photo, older gentleman. This is a gentleman in his 60s. He has both fat accumulation, about a 1/2 inch pinch on physical exam, and skin laxity, which is probably normal for age. But you can see in the straight line under the jaw, the angle or lack of angle in this area. Again, this is probably a 1/2 cup of fat removed in the after photo. But you can see a leaner appearance in the submental area, more angulation here. So overall, good results. Still a little bit of skin laxity, but compared to the before, you can see this gentleman was pretty happy with his result. Now, this young woman in her 20s, on physical exam, when I pinch under her chin, probably doesn't have a 1/4 inch or maybe right at 1/4 inch of a pinch under her chin. This is one during the consultation, I would tell her, not to expect dramatic results, but she'll be able to see some increased definition on her jawline and maybe a little better angle in the submental area. And in this case, only 50 cc's of fat was removed. 50 cc's is just a little over 3 tablespoons of fat. But you can see rather dramatic results. Good skin retraction, better definition on the jawline. Hi, so I hope this video helps you to understand a little bit more about chin liposuction. As I mentioned previously, this does require a physical exam to determine whether you're a good candidate. So I'd encourage you to give us a call at your convenience or email us with any questions. Hope to hear from you soon.